What are the risk factors involved for teens during prom season?
You know, I've really identified maybe just two pressures. I think pressure to drink and pressure to have sex. You know, in combating these pressures, the number one thing that in my work at Henry Ford that I really impress upon parents is the relationship with your kids.
Dr. Ed Coffey, chairman of psychiatry at Henry Ford Hospital, says the psychological reaction will vary.
About 30% of those individuals would experience some form of at least an adjustment reaction after exposure to the trauma. But only a fraction of that 30% would go on to experience real post-traumatic stress disorder.
Dr. Mark Kelly, CEO of the Henry Ford Medical Group, on the other end of our line. There's a new study that shows hands-only CPR. It's pretty good.
Chest compressions may be just as good as the combination of chest compressions and the breathing. And the outcomes turn out to be about the same.
Let's talk about why you think it is so important to require healthcare workers to get a flu shot this year.
Nationally, the rates of healthcare workers accepting immunization has been about 50%. And here at Henry Ford, we've actually been a little bit better than that, but there was still a gap.
They call it the golden hour. That time right after a serious injury that's most critical to a victim's survival is the time when a level 1 trauma unit can spring into action and provide everything an injured patient needs.
It requires commitment in terms of not only dollars, but people and resources.
Brent Patterson's all smiles after a successful intestine transplant at Henry Ford Hospital in Detroit.
The transplant is an intestinal combined multivisceral, which includes the stomach, the pancreas, and the small intestine.
The NanoKnife is not a knife. It is exactly probes that are placed around a tumor that's hooked up to a computer that provides electrical current through the tissue in order to kill the cancer cells.
It is time for Health Talk, and on our conference line we have Dr. Tom Mickelson, the co-director of the Hermelin Brain Cancer Center at Henry Ford Hospital.
Brain cancer is kind of under the radar as far as the top cancers people know about, breast cancer and colon cancer, because they outweigh brain cancer by their numbers. But obviously the consequences of these tumors is particularly devastating.
Vitiligo is a skin condition that causes areas of the skin to lose color and develop white patches.
In certain types of vitiligo patients, we felt that we could treat these people with surgery.
Dr. Iltefat Hamzavi and his colleagues studied various techniques being used in South America, Asia, and the Middle East.
Started collaborating with the National Center for Vitiligo in Riyadh, Saudi Arabia, who has researchers from all over the world working on this condition.
Dr. Gregory Barclay, a neurologist at Henry Ford Hospital, has treated patients with Alzheimer's disease.
The challenge has been is to find a test that you can do on people that is non-invasive that demonstrates that they have Alzheimer's disease.
A man from southwestern Ontario is one of the first patients with head and neck cancer to be treated robotically at a U.S. hospital. We follow him into the OR, talk to his surgeon, and find out when this groundbreaking surgery will be available on this side of the border.
I'm hoping to feed my patient right after the procedure, and should be able to talk, and will stay probably in the hospital for 2 days, and afterwards he'll probably be able to go back to work next week.